the principle is that we want to repair critical size defects. So these defects are bone defects that are unable to heal by themselves during the patient's lifetime because they are too big, so the two pieces of bone cannot reach each other. So the current gold standard to treat this kind of defects is the bone autograft. So we take a piece of your bone elsewhere in your body and we implant it on the site of defect. However, there are a lot of complications with this technique because there is limited availability, there are donor site morbidity also, and there are several surgeries. So to have a better solution, we proposed to 3D print a scaffold, which can be personalized to the patient. And then we functionalize this scaffold with a biomimetic film, which is in 2 dimensions. So we have the 3D structure coated with a 2D film. And this film will mimic the extracellular matrix of cells. And then we will load a protein, which is bone morphogenetic protein 2, so also called BMP2. It's a growth factor which will trigger bone repair. So we will load this protein in the film, and when we implant the scaffold with the film and the protein, then the protein will be released, and it will say to the cells, "Go on, please make some bone around this scaffold," and therefore the bone can regenerate. So that's the principle of this study, and also what we did in the paper, which is called the same as my presentation, so the title is the same. In this paper, we showed that we can use BMP2 doses that are very low compared to what is done actually in the clinic. So in the clinic, we have collagen sponges with the same protein, BMP2, but the doses of the protein are very high. So it's risky for the patient. And here we decreased the BMP2 dose by 20 to 75-fold. So it's a huge decrease, and we have still good results. So that was interesting. And also we showed that the results are depending on the BMP2 dose. So the more BMP2 you put, the more bone you will have, but it will be slower than when you have small BMP2 doses. In this presentation, I was saying that we used this scaffold in a mini pig model, so in the mandible of mini pigs. And now to translate to further to go to the human in few years, we are trying it in the metatarsus of sheep because it's known to be a very hard model to repair because it's a very hard bone and there is a very low vascularization. And without vascularization, we cannot have nutrients that are very important for bone repair. So it is quite a challenging animal model that we are trying now. And so far we have good results, but we didn't finish the experiments yet. What we saw is that, so we did X-ray radiographs, computed tomography scans, and also microcomputed tomography scans and histology. And so what we saw with the X-ray radiographs is that qualitatively we have more bone with the highest BMP2 dose that we tested, because we tested 3 BMP2 doses. And as I said, the kinetics of bone repair are also dependent on the BMP2 dose. So the highest dose you will have, the slower the bone repair will be, but it will be higher. And also we showed the same tendencies with quantitative results of computed tomography scans. So we have we had a positive control, which was a bone autograft. And we showed that with the highest BMP2 dose that we used, but which is still 20-fold lower than the dose used in collagen sponges, we had similar results in terms of bone repair than with the bone graft. So it's a promising solution. And also we showed with the histology that we didn't have any inflammation. And also there were some blood analysis which showed that on a systemic, so a global view, we didn't have also any inflammation.